State leaders pushing back against a nationwide vaccine mandate that the federal government doubled down on today. Thanks for watching. I'm Rolly Hoyt.
And I'm Marlisa Goldsmith. The White House unveiled new rules that will require millions of unvaccinated working Americans to get the shot. All federal employees, federal contractors, and healthcare workers at facilities receiving Medicare or Medicaid have until January 4th to be fully vaccinated. People who work at businesses with more than 100 employees must also be vaccinated by the beginning of the year or test weekly and wear a mask at work.
Governor Asa Hutchinson criticized the move that came from the Biden administration this afternoon.
Businesses, very importantly, should have the freedom to decide for themselves what is the best for their workplace and the health of their workers and customers.
The governor promised to fight the mandate and voiced his support for Attorney General Leslie Rutledge in her pending lawsuit against these rules. He says he's also working with state agencies to find testing alternatives for businesses and employees. Now, we knew about this mandate before, but now employers have a clear picture on timing, requirements, and enforcement.
THV11's Mercedes McKay breaks down what this means for us in Arkansas and how employers are now reacting.
We were looking at some very hard decisions that were going to have to be made by a lot of ambulance services around the state.
Ken Kelly with the Arkansas Ambulance Association describes the White House's vaccine mandate extension as breathing room.
Definitely potential for significant staff reductions. Across the state, that could be, an ambulance for an entire community could not be staffed.
A survey in the summer showed ambulance department vaccine rates ranging from 25% to 90%. Before the December 8th deadline was extended to January 4th, Kelly says they could have lost anywhere from 15 to 20% of their workforce. The month delay giving them just what they needed. Time.
It gives time for staff education. It gives time for those that are wanting to receive the vaccination.
Kelly and his staff still have to go through the thousands of pages to see exactly where they fall in line. Attorney Steve Rawls says OSHA has had employee rules like this for years. This is just adding on to it.
This is just one more thing employers have to do to keep employees and the public safe.
The mandate requires all federal employees, contractors, and healthcare workers at facilities that participate in Medicare and Medicaid to be fully vaccinated by the beginning of the new year. But Rawls says that's not the only people affected.
Any employer with 100 more employees is going to have to either require vaccination or a regular negative COVID test.
Rawls says businesses who don't follow the rules could be paying fines of nearly $14,000 per employee per violation. If workers don't get the shot or take a test, they could be out of a job.
The rules say you can't be allowed at the workplace if you aren't either vaccinated or testing negative.
As for employers, Rawls says they need to use the next 8 weeks to get some rules in place.
You need to communicate with your employees about what you as an employer are going to expect of them by January 4th.
Mercedes McKay, THV11 News.
Mercedes, thank you. The rules are going to require employers to keep records on who's been vaccinated and how the testing's going.
Rawls says employers should go ahead and start thinking about what those files need to look like before the rules take effect.